Go ahead, Lee. Long minute. Welcome to the candidate forum for the elected positions on the board of the Health District of Northern Larimer County. Greetings to those who have joined us in person, and this event is also being shown on Comcast channels 14 and 881 and Connection Channel 14. It is also recorded and will be available on the website of the Larimer County League of Women Voters website, and also on the Fort Collins website at www.fcgov.com/FCTY on demand. So there are a lot of ways to see this show. First of all, I'd like to just make an announcement here. There are 3 members of the Board of Health that are incumbents, and because of the open records law, we wanted to verify that, to state that there is no business being conducted, and so that it doesn't violate the open records law, open meetings law. The Health District Northern Larimer County is a public agency, a governmental special district that has been meeting local health care needs since 1960. That's a while. The district provides residents of Northern Larimer County with dental, mental health, preventive health, and advanced care planning services, in addition to connecting people to more affordable health insurance and also prescription assistance, which is really important. Voting is on May 3rd. It will take place at 2 polling stations in the Fort Collins Health District main office and at the Spirit of Joy Lutheran Church. To vote by mail, an application for an absentee ballot must be filed by April 26th. Learn how to request an absentee ballot by going to the Health District's website, which is very simple, healthdistrict.org. To learn more about these candidates, I encourage you to visit the League's online voters guide on vote411.org. The site provides information on voting procedures and unedited answers to questions that we have posed to all these candidates for offices at the state, local, and national levels. In full disclosure, in the past, I served on the board for 2 terms, so I'm especially grateful to the candidates for applying to be elected to this very important board. Thank you. And also thank you to the League of Women Voters of Larimer County and the City of Fort Collins for hosting this event. Our first part of the forum will be the 6 candidates who are running for 3-year terms. 3 candidates will be elected in May. The second part of our program will be after a 10-minute recess, when we have a forum with 2 people who are running for 1-year term. And I'd also like to make a note that there's a name on the ballot named Mark Longshore. He has withdrawn his name as a candidate, but the ballots were already printed. First, I would like to ask our 6 candidates to introduce themselves by stating why they're running for office, what skills and experience they bring to the position, and anything else you might want to say. You have 90 seconds each, and we have a ruthless timekeeper. We'll start with Julie.
All right.
Julie Field.
All right, thank you. I am Julie Field. And
Turn the mic on, Julie. Do you have your... There we go.
I had this in the courthouse, the same microphone, and I always did that as well. My name is Julie Field, and I, first of all, want to thank the League of Women Voters. Many of the people in this room are people that I know from my mother-in-law was very active in the League prior to her passing last summer. She worked on the League for 20 years, died at age 97 last summer, and was very dear to the League, and the League, therefore, to our family. So thank you very much for what you're doing, not just tonight, but always with the League. My name is Julie Field. I am a long-time resident of Larimer County in the district. I am passionate about service. I was a district court judge for 11 years. I retired in October of 2021 and have been looking around for opportunities for service. This one came to my heart and being close to my heart because as a district court judge, I founded the wellness court, which dealt with problem-solving issues for folks with mental health and substance abuse issues. So I am very, very excited to have this opportunity for service. I will use my skills as a judge, as a mediator, as an attorney, and I look forward to having the opportunity.
Thank you. And the next one up is Brian Ferens.
Good evening. My name is Brian Ferens. Have lived in Fort Collins for about 18 years with my wife and my 3 young children. I am running for the board because I think I have a unique perspective to offer on the board, being a prior employee of the health district of 4 years. I was their director of their community impact team. I've been doing behavioral health and criminal justice systems improvement work in this community for the past decade, and I'm now with Prudhoe Fire Authority trying to bring that public health lens into that space as well with fire and emergency services. I think with the transition of a new executive director after 27 years for the health district, it's really important to have board members that are very familiar with a health services district and the complexities around it and the opportunities with it, that are the work that I did with the community impact team, working with our community partners, trying to improve health and working on those community-based projects and understanding the needs and the gaps in our community, as well as understanding the needs of the staff at the health district and working side by side with them during 2 years of a pandemic. I think that is really important experience to bring to the board during this transition. Thanks.
Thank you. And the next one up is Joanna Ogoa Giron.
Thank you. Buenas noches a todos. Chivo. I want to start by acknowledging that the land that we are was originally from the land takers of the Ute, Arapaho, and Cheyenne tribes. I wanted to make sure that we acknowledge that. The other thing, if you have time this weekend, there is going to be the powwow. The Northern Colorado Association for the powwow is put in. So if you have time, please make sure to go there. I am Johanna Ulloa Giron. I am from Bogota, Colombia. I am an immigrant to this country. I came to this country as a grown-up woman. I have a master's degree in psychology and a master's degree in social work. My life has been around service and serving communities. I don't have memories, even since I was a little girl, of not being in service of the community. So this comes very natural to me. I think the skills that I bring are lived-in experience with many of the issues that we're talking about when we talk about social determinants of health. Also, I bring a different perspective from the usual board members. I think it's not a secret for the county, the city, and different districts that we want to have diverse voices in different boards. And I think I bring that unique perspective as well. I have been in the board for a year already, and I think I have knowledge about the services, programs, issues, barriers, and the place where the district is at this moment. And I think that's really relevant and important at this moment. So those are some of the skills that I bring, and I hope I continue to serve the health district. Thank you.
Thank you. And our next candidate is Molly Gutilla.
Yeah, thank you, Lee. Good evening, everyone. My name is Molly Gutilla. My pronouns are she and hers. By day, I am an assistant professor at Colorado State University in the School of Public Health. I'm serving and running again for the board for 3 main reasons. The first is that I deeply am committed and believe in the mission of the health district, and that is to improve the health for all community members. It is very true that this is a very great community to live in for many people. It is also true that we do have people in suffering and people that experience worse health than everyone else. The second reason is that the health district while committed to community engagement, there's room for us to grow in the way that we center community perspective, community voice, community data. and experience in how we make decisions in improving health and moving forward. The third reason that I'm running is that the health district deserves someone who's familiar with the organization and is experienced. It is a time of transition in health as we come out of a global pandemic and we enter into a new phase where we have a new executive director. So I'm excited to be an incumbent and running again to kind of continue the work that I've started the past 4 years. Thank you.
Thank you. Our next candidate is Nicole, but she said we could call her Coco Peterson. Coco.
Yes, I have gone by Coco my whole life, so feel free to address me that way. I want to be a part of the health district from just a personal level. I am a part of this community. My children are a part of this community. My husband grew up in this community, and my aging in-laws are part of this community. They will kill me for saying the aging part, but it's a different phase of life, and it is also important. On a professional level, I've been in the health and wellness community for over 20 years. It started here in Colorado State with a bachelor's in exercise science, where I was an exercise physiologist, worked in orthopedics, personal training, and as well have always served my community. It then led me to yoga practicing work, where I really learned that mental health and physical well-being are intertwined and that we can't leave one out without the other. This ultimately led me to a master's in healthcare ethics, where I really had a focus on vulnerable populations, which we can all be vulnerable at one part in our life. Children, aging, if we're lost our job, COVID really brought up a lot of this. And so with any of us can be in that situation where we really need these services, and they need to be inclusive. They need to include diversity. They need to be equitable. And it's important that we find unique and innovative solutions to integrate this kind of care.
Thank you. And next we have Joseph Prouse. Do you like to call us to call you Joseph or Joe?
However the spirit moves you.
Lovely. It's your turn.
My family calls me Joey, but it's a bit diminutive. My name is Joseph Prouse. I'm a family medicine obstetrician here in town. I've lived here since 2013. I am running for re-election to this board to continue what I started 4 years ago. The CEO of our group, Jim Sproul, asked me at that time if I would consider running for the board. He pointed out that my experience, my interest, I have a master's degree in public health and epidemiology, an interest in population health, preventive care, addiction treatment, mental health, and at the time he pointed out that perspective was needed on this board. So I ran at that time, and I'm running again, in particular to work with our new executive director, Robert Williams. The choice of him I'm absolutely thrilled with. I think he's going to be fantastic for this community and for the board. What I bring to this position, I believe, is perspective. I think that this board needs one physician, should not be a board of 4 or 5 positions. I think that a wide variety of perspectives encompassing a huge breadth of experience will result in the, okay, stop. Thank you.
Thank you. That was very, very good ending. Stop.
Stop. I do what I'm told.
So we'll start our questions now, and we'll start with Julie. And the first question is about health care access disparities. How can the district assure that equitable health care access is provided to all the community members?
That, to me, is the critical question for the health district, is making sure that there is access. I think one of the things that I've seen in my work with people who were suffering with mental health and substance abuse issues is many of them are homeless They are unhoused people in our community, which is shameful, but we need to find them. And the fact is, we can find them. And one of the things that I saw in the wellness court is that it was with a dedicated team, it was possible to locate those people with needs. And I think one of the things that the health district can do well is to make sure that it is reaching out not just to the folks that can easily find the services, but those who are unhoused by going out into the community. I know there's been some initiatives that have been taken, and those should continue.
Thank you. Next one up is Brian. I'll repeat the question. How can the district assure that equitable health care access is provided to all community members?
Well, I think the health district has a good history of asking that question in the community and finding out that there are disparities in healthcare access, but I think that it needs to go further and ask communities historically that haven't accessed healthcare why. I think that they need to think creatively about how to reach those populations that are not traditionally accessing healthcare or not comfortable accessing healthcare. I think that they need to create solutions that are meeting people where they're at, and when they listen on why they're not accessing care, they need to create programs and services that are adaptive to their needs.
Thank you. Next, answering the same question is Johanna. And Johanna, would you like me to read the question again?
Yes, please.
Okay. How can the district assure that equitable health care access is provided to all community members?
I think that's a really good question. I think a lot of us who have been working in social sciences and in community in this district, we are very familiar that we have a cycle of analyzing problems and overanalyzing them and doing a lot of community assessments. This is true to the health district, to the city, to the county, to other counties, to the state. And I think we need to move from continuing to analyzing and gathering information and actually being in community. I think one of the matters about accessing health services is also proximity. So are we outside in the communities that we need to be providing services? One example that I have tried to bring this last year to the health district is rural areas. We need to be in rural communities to be able to provide the services that best fits the needs that these communities have. And the same is true to traditionally marginalized communities. How can we start thinking about the barriers, taking those barriers down? How can we create innovative services that actually are culturally relevant and attuned? I can talk more about that, but my time is up.
Thank you. And next, answering the question will be Molly. And Molly, would you like me to repeat the question?
Sure. Yes, please.
How can the district assure that equitable health care access is provided to all community members?
Yeah. This is the core of the mission of the health district, and some of my colleagues have noted the health district we have data on this, and traditionally we've done a pretty decent job in knowing that we do have disparities, we do have gaps. There are ways we could do better in measuring that. But I think the core of addressing this is probably in trust building and relationship building with communities, especially those populations that traditionally haven't had good access to medical care. One of my favorite authors, Adrienne Marie Brown, she has a great saying, and she says, to move at the speed of trust. So I think the health district needs to continue to use data and information, but also just center relationships with community members and get to the root of the problem in understanding why we still don't provide equitable access or the access that we'd like to provide for all people living in our community.
Thank you. And next is Coco.
Yes, thanks. Again, I echo a lot of what everyone's been saying. And I think the traditionally marginalized or the people that we have trouble reaching have a lot of barriers. They think about culture and community in different ways than we traditionally do. And I think one of the ways that we can go into community, because I do think that's an important way to reach, is to partnership with some communities that they do trust and bring our services into some of those trusted communities to build partnership or at least education about what services are out there. I think that's a big thing that I've learned too with the health district as I have talked about it, is a lot of people aren't even aware of the services that are out there. And so to bring that trust and that partnership to places where there is trust, and then partner is and integrate services is going to be very helpful. Thank you.
Thank you. The next one is Joseph. And Joseph, would you like me to repeat the question?
Yeah, one last time.
You bet. No problem.
I'm nervous and I'm like forgetting things.
I'm old and I forget things. How can the district assure that equitable health care access is provided to all community members?
That is a tall order in America to really deliver equitable health care. I mean, the root of the problem it runs deep. Having a nationwide, essentially for-profit healthcare system ensures that people with lots of money get great care, and so many other people are left behind, and the disparity in wealth seems to only be getting greater. That's a problem in our community, and that's a tall order for the health district to begin to address and solve that problem. But there is so much that we can do and have done, and with the choice of art, we chose Robert Williams in large part because of he really had the credentials, the ability to listen, not tell, not direct, but listen, and a commitment to get out into every last nook and cranny of this community and find out what people need, what we are missing. So that's
Thank you.
in broad terms.
Thank you. The next question is a bit related, I think. And this time we're going to start with Brian. In what ways can the health district partner with other key community health organizations? And what organizations might those be?
Well, I mean, there's a lot of different ways that the health district can partner with other health partners. I mean, one key partner that the health district is intertwined with is UC Health, and this unique relationship that the health district has with UC Health. So that's a partnership that I think can be explored further to hopefully potentially increase funding for the health district. The health department, the health district and the health department worked really closely together during COVID and the pandemic response. And I think they did that really well. I think working with our federally qualified health centers, the health district has shares staffing with other organizations, and you braid funding together in order to fill the gaps in the community. When one organization can't bring everything to the table, the health district can step in and help fill that role because of our unique taxpayer budget. So I think there's a lot of ways that the health district can do that.
Thank you. The next to answer the question will be Johanna. And Johanna, would you like me to repeat it? Happy to do that. In what ways can the health district partner with other key community health organizations? And you might mention which organizations you might have in mind too.
Yeah, I think I have to give kudos to the staff at the district because they have done a good job of partnering with different organizations. And Carol has done a really good job of developing a strong relationship with the health department and with other health providers. I think one of the biggest steps for us to take now is to partner with organizations that are really good at serving people who are traditionally marginalized. I think in terms of our budget is in the medium of the budgets of the district. So we have the county and the city with really big budgets, but we also have grassroots organizations and nonprofits who have tiny budgets. So how can we best leverage our resources, our staff? And some of the organizations that come to mind are La Familia, Alianza Norco, BIPOC Alliance, Suicide Prevention Alliance, the Cultural Enrichment Center, Splash, La Cocina, to name a few. There's some of the few organizations that are doing amazing work. We don't have to duplicate services. We don't have to start doing what they're doing, but we can be partners. Thank you.
Thank you. And next, Molly, would you like me to repeat the question?
I think I got it.
Okay,
Yeah.
go for it.
Yeah. So my colleagues have already listed a number of partners, healthcare organizations. So they've kind of answered the question for me. I want to add something unique, and that is we actually don't have to partner with every single thing. You know, our partnership should be intentional and aligned with our priorities and our mission. We have a number of healthcare organizations. We have a nonprofit community, a large nonprofit that works on a lot of health issues. So our partnership should be strategic and aligned with our missions. The other kind of lens that I would put on this is that while we do provide healthcare services and treatment is needed, the other eye that we need to have toward is just prevention too, right? And so preventing someone from even, needing mental health treatment. What do we do to work upstream and prevent it? And again, there are nonprofits, there are other organizations that could be great partners for us in trying to think about in preventing and not only treatment.
Thank you. Coco, would you like me to repeat the question?
I think I have it as well. Again, many good organizations that have already been mentioned, La Familia, the Matthews House. There's so many other, but I do think one of the places that we do need to look at is where there's redundancies, because we don't want to just be doing the same thing that someone else could be doing just as well. So look at redundancies and then find those programs. I think another one is our law enforcement. A lot of people get out of services or jail or on probation, and they are in need right there and then. I think that's an area that's been worked on, but there's so much more there as far as mental health, substance abuse, and actually just preventing some of these diseases. I think that's a nice place to start partnering.
Good, thank you. Joseph, would you like me to repeat the question?
I think we're good. Partnering sounds great. I would settle for not competing, not harming local nonprofits with similar missions. And this has been a point of contention even in the past 4 years. At several points, the health district has essentially been in direct competition with some local nonprofits for funding. And Molly and I took a somewhat controversial stance in a few instances that the health district should not pursue certain grants because other community nonprofits that provide vital services really depend upon those, and in some instances can do that job, are much better situated to do those jobs than the health district is. So strategic partnering, not competing is essential. We cannot starve them of resources. And certainly La Familia, fantastic example, the BIPOC Alliance of organizations that we need to support.
Thank you. Julie, you get to be the last one instead of the first one.
This is so hard to be last on this question because everyone has given such fantastic answers. And I want to just say what they said, but I'm going to add one more thing in addition to what they said. One of the health department, of course, has a huge partner, is a huge piece of that connection of what we do. I also want to recognize and point out the behavioral health center that is online and on its way. And I think that is something that we need to, as the health district, be mindful of and make sure that we are ensuring that partnership is as robust as it can be. So everything that they said is strategic partnering, not competing. And one other piece I would say is making the lens as big as possible in terms of the view. And I think about safety as well, community safety, and think about different organizations such as Crossroads Safe House.
Thank you. Now we have a new question, and we're going to start this time with Joanna. And the question is, how might the district help to educate the public around behavioral health issues?
This is a very interesting question. I think when we talk about movements, including health movements, one of the first things that we need to know is definitions. So when we start talking with jargon, we already lost a lot of the people that we want to educate. The other part is to think that the only role that we have is education. We also need to learn from people about what keeps them healthy, what makes their life healthy, what promotes health in their life. So I think it's changing the narrative from we're going to teach to a narrative that how can we co-create healthy scenarios, healthy environments. Having said that, I think there are different pieces for this. Everybody learns in different ways. So how can we reach out for people in different ways so they can access information? How can we go and have conversations? How can we have information in different formats, digitally, in person, in coffee shops? So I think it's a matter of co-creating and educating each other instead of just pretending we know everything and we're experts at everything. Thank you.
Thank you. Next, we'll go to Molly. You bet. I'm sorry. I wasn't on the ball here. How might the district help to educate the public around behavioral health issues?
Okay, yeah, thank you. Part of educating people is, again, I think being in relationship with them. And the health district, we have some work to do around people in our community knowing who we are, trusting us, and understanding us. The health district sounds a lot like health department. And while we partner with them, we work very closely with them, we're actually a completely different organization, as probably most people in this room know. So we have some work to do there, because it's not just the message, but it's the messenger that matters when it comes to providing education. So I think the other opportunity probably is to work and establish some community leaders that identify are part of particular community groups, such as Spanish speakers, such as the LGBT population, and have community leaders that educate on health issues, trusted members of populations. So thank you.
Good, thank you. And next we have Coco.
Yeah, how to educate the public on behavioral health. I think one of the things that we can do is educate our first line people about the services. So our family physicians, our law enforcement, our nonprofits, that we do have these services. However, I can tell you from many personal experiences that there's also just not enough. And so I think education is a key aspect, but if there's not enough services and there's not enough care and there's not enough beds and there's not enough, it is very hard. Education only goes so far. And I think that's one area where we really have an opportunity to improve.
Thank you. Joseph, again, the question is, how might the district help to educate the public around behavioral health issues?
The word educates implies that knowledge equals behavioral change, and it's a fairly core tenet in public health that you can't rely on just that teaching someone that cigarettes equal bad will get them to quit smoking. So we need to be careful when we're talking about educating and not be like a paternalistic figure saying they're there. I want to echo the sentiment that we experts, don't get to stand on high and tell people what good mental health necessarily is. The health district, as its Connections program, on the other hand, has been immensely helpful. Connections and Kayak to my patients. I make referrals to Connections roughly every day. That bit of education, as in a patient who is in needs some mental health support, the education, where do I find a therapist? Who that works well with my insurance? That's a vital role. The Changing Minds program that the health district had in relation to addiction, that's been vital in the community. Thank you.
Okay. I think about this question in three ways. I think about the who is it that can help educate the public about behavioral health issues. And what my colleagues have said about building trust in the community and making sure that those leaders in those portions of the community are conveying the message is critical. I also think about the what. There's a lot of fear around mental health issues. When you say mental health, when you say behavioral health, when you say mental illness, there's a lot of fear. I like to think of it as the game of life. Sometimes in the game of life, if you all played that when you were kids, you drew cards that took you somewhere you didn't want to go. And sometimes people have mental health issues because they've drawn that card. That doesn't mean that they're not on the game of life. It doesn't mean that they're not one of those little blue or pink people driving around in their car. It just means that they have a different journey. And then the third piece is the where. Where is this going to happen, this education? I think it needs to happen in the community. I think it needs to happen in the community where the people are who are having issues.
Thank you. And wrapping up this question is Brian, and I can repeat it if you like.
That's okay.
Okay.
Yeah, I think to Johanna's point about jargon and a conversation around behavioral health, words definitely matter. And stigma is a huge piece of people not accessing care for mental health and substance use disorders. I think the health district has started that work in helping to reduce stigma around these diseases and shining light that they are health diseases just like any other chronic disease. I think that the health district can continue to highlight and showcase where to reach services and how to access them. And I also think, like Molly said, that the health district can go much further upstream and start working on how do we prevent adverse childhood experiences from happening? How do we stop the generational trauma cycle? How do we provide services that are addressing those issues instead of the reactive in treatment?
Thank you. Now we'll start all over again with a new question. And I think this time we'll start with Molly. Is that all right with you? Okay. Based on recent reports, it's a related question. There's a fentanyl crisis in Larimer County and the entire state. What can the health district do to combat this crisis?
Yeah, the answer is it depends. It depends. I think, we need to understand a little bit more about the crisis and how that shows up in our local community. And there might be partners, or the district might know more about that and understand it, and then make decisions. Complex problems like substance abuse, like mental health, there's not one solution to them. And that's one reason I'm thankful that the board is 5 people and the staff is large at the health district, because we're talking about messy, complex problems that don't depend on one person's idea or one way of solving them. So I think my answer is, we need a little bit more information to know how to address that health crisis, that health issue.
Thank you. Coco, would you like me to repeat the question? Sure. Okay. Based on recent reports, there's a fentanyl crisis in Larimer County and the entire state. What can the health district do to combat this?
Yeah, I think this is the second part of the opioid crisis. And I think there's a lot we can do. And one of the easiest things is to educate on what fentanyl or opioid overdose looks like, public service announcements, getting Narcan, the reverse opioid antagonist, into our CSU dorm rooms, into more of a community, into our everyday safety packs. This happens way more than you can think. It's in every substance. It's one pill can kill. It is not just the opioid crisis, it is worse. There's actually a bill right now in Colorado that is working on this. And I think to take a policy stance is going to be really important here, again, to get that upstream need, see what that education and statistics and what other people have already found to be true, and use it in our community.
Thank you. And next up is Joseph. Would you like me to repeat the question?
Yeah, one more time.
Sure. Based on recent reports, There's a fentanyl crisis in Larimer County and the entire state. What can the health district do to combat this crisis?
I've lost friends to fentanyl overdose. I've lost patients to fentanyl overdose. The statistics are overwhelming. Now, the pandemic kind of shut this down, but the health district had taken a giant leap in the right direction. I mentioned it before, the Changing Minds program, where Dr. Corey Waller, the health district, brought him out. A couple of sessions, some public ones, and then some sessions directed specifically to physicians, public health professionals, social workers, address that, removing the stigma of talking about substance use disorders. And that program actually caused a dozen local providers whom I know to get their XDEA waivers to be able to prescribe buprenorphine, myself among them. It was in response to what I learned through the health district that prompted me to start taking a more aggressive stance in treating opiate addiction. So continuing with that, redoubling, tripling down on those efforts would be valuable.
Thank you. And next, we're back around over here to Julie. Would you like me to repeat the question, Julie?
If you would, please.
Sure. Based on recent reports, there's a fentanyl crisis in Larimer County and the entire state. What can the health district do to combat this crisis?
I think the health district can and has provided leadership on this issue. I think a lot of times when we are talking about drug use issues, we look to law enforcement. Law enforcement, as the first responder, is often the first responder who sees what the problem is, but criminal justice is not the answer. And that's a retired judge telling you that. Substance abuse is a profound problem in our community. And one of the things that I think we need to be open to is making sure that we are looking at medically assisted treatment and harm reduction in regard to that. So I think partnering with all of the folks that are concerned about this issue, that does include law enforcement and those first responders. It does include making sure that there is Narcan available. It does include making sure that we are educating all of our providers about medically assisted treatment and not being afraid of that.
Thank you. Brian, would you like me to repeat it?
That's okay.
Okay.
Yeah, I think, the opioid crisis, fentanyl crisis, it's largely a public health issue. So the health district is poised to step up and help this. I think that all the things that you all talked about, increasing access to naloxone, fentanyl testing strips, increasing access to medication-assisted treatment. There are proven practices that maybe aren't popular, but are proven to be effective, syringe access programs. And I think the health district can work with our Board of Health to help push increased access in our community, because we know that works and that keeps people alive long enough for them to start to recover. And so I think also the health district taking a stance and speaking out against legislation that is going to further criminalize people with substance use disorders, because we know that hasn't worked historically and it's not going to work with this. I think those are all strategies the health district can take.
Thank you. And next up, we have Joanna. Would you like me to repeat the question, Joanna?
No, thank you. That's
Okay.
the beauty of being the last one, I guess. I think my answer is not going to be a popular answer. I won't add more than the other people here tonight have mentioned. I think the health district joined the Mental Health and Substance Abuse Alliance that has more than 30 organizations in 2017 to talk specifically about substance abuse and substance use. So I think everything that everybody has answered has merit. I think one of the pieces that I think continues to be missing, and that's why we will continue to have these conversations, is what is causing these crises. When we're talking about mental health, substance use, housing, depression, suicide, all of those have common threads. And I think at some point we need to start thinking, how can we leverage our resources, the partnerships that we have, and start really thinking about innovative solutions to prevent this crisis from continuing to pop up. And these are crises that we kind of saw coming from a long time ago. Just COVID exacerbated a lot of those. But yeah, thanks.
Thank you. We'll come up with a new question now. And this is related to the health district has had historically a role with policy as well as with programs. And this is kind of a policy question. Would you endorse a nonprofit single-payer form of health care financing, such as improved Medicare for all? Please explain your answer and whether the health district should adopt a resolution supporting it. And we're going to start with Coco.
Wow, that is definitely a complicated question. And this goes, I mean, I researched this for semesters in my master's program. And I think that although that sounds wonderful, and I think there's a lot of pros to that, and I think we should aim towards something where there's at least a basic health care for all. I truly believe that in my bones. I think, unfortunately, the pushback is so much that it's hard to get that done. But I think what we do need to do is use our partnerships, talk to physicians, and figure out a way to bring them to the table, because they're ultimately what is allowing this to not go through, some of them. And you do lose some of the competitive, integrative, really technologically advanced care when you go to a single payer system. You lose some of that competition and innovation.
Thank you. Next up would be Joseph.
Not to put too fine a point on it, but as a primary care physician, I would give my right arm, maybe my left, for single payer Medicare for all type system nationwide or even just in Colorado. The benefits would vastly justify any cost. We pay more per capita by a long shot than any other nation on the planet, and we get bad outcomes for it. Preventive care suffers. I spend, it seems like on an average day in my work, about half my time just solving silly problems that shouldn't need to be solved, figuring out what hoops Anthem or whatever insurance company makes me go through to get something that the patient needs. They require it. This creates a system of checklist medicine where people with resources get great care, possibly too much care, and the vast majority, we have to practically have a bake sale to make basic things happen, and it's a terrible system.
Thank you. Julie, would you like me to repeat the question? Would you endorse a nonprofit single-payer form of health care financing, such as improved Medicare for all? Please explain your answer and whether the health district should adopt a resolution supporting it.
Yes. The answer is yes.
Turn your mic on, Julie.
Turn the mic on. The answer is yes, absolutely, and I'll say it even louder. People should not have to look at their bank account first to see if they can go to the doctor. People should be able to go to the doctor without having to worry about that. I think that many, many people recognize the importance of healthcare. Obviously, we are all running for this board on the health district because we believe that there needs to be access to health care for everyone. And I firmly believe that. People, in terms of, do I believe that there should be a single payer health plan like Medicare for all? Yes, absolutely. Would I support adopting a resolution on behalf of the health district board? I need to discuss that as a member of the board before saying that my personal opinion should hold sway.
Thank you. Next up is Brian. Would you like me to repeat the question, Brian?
Oh, thanks. Yeah, I'm fully in support of a single-payer healthcare system. I think that there's no question that is the most equitable system. It's been proven to work elsewhere. But I think that the system we've built in our country, there is a ton of detangling that has to be done in order to produce that system without causing massive healthcare gaps. And so it needs to be thought through really well and have the right people in our community having those discussions. I fully support the health district having those discussions and working with community partners to figure out the steps to go down that path, because I think that is the most equitable system that we can have in our community. But it's extremely complicated, and to shift to that too quickly would cause really big gaps in our healthcare and make it worse for folks.
Thank you. Next is Johanna, and would you like me to repeat the question?
Yes, please.
Sure. Would you endorse a nonprofit single-payer form of healthcare financing, such as improved Medicare for all? Please explain your answer and whether the health district should adopt a resolution supporting it.
The answer is yes, for all the reasons that previously has been explained. And I think it can be, of course, we will have conversations about that. We will take into account the staff, the recommendations before we adopt any resolution. That's usually how it happens. But I think that one of the things that we need to think about this question to begin with is that the stage has been set up for us to believe that these kind of questions are hot, that they're a hot topic, and that it is radicalized. When actually we're talking about something that most of us agree. Do you want to go bankrupt for paying medical services? No. Do you want to have good services that actually fit your needs? Yes. This is one of those issues that actually unite us all. So I think we need to start thinking differently about this question and stop saying that it is so complex and so difficult that it is hard to achieve. It is possible. Other countries are doing it. So I think we need to find, again, common threads and move ahead with innovative solutions.
Thank you. And rounding out this question will be Molly. Would you like me to repeat it, Molly?
I think I got it.
Okay.
So the answer for me is yes, too. I'm not going to be the dissenting vote on this with this crew up here already. It is yes. And it is possible in other areas. I mean, Joe said it nicely. We pay a lot for our health care. We don't live longer. We don't have better health than other countries compared to around the world. It centers on something that I agree that we do share, and that is that health should be a human right. You should be allowed to live your healthiest life regardless of your age, your gender, your sex, your race, your ethnicity, your income, your sexual orientation, all of those things. And I do believe that it's a complex change, and until that happens, we are fortunate to live in a place like the health district where a lot of health is local, and we have a local resource that until we have single payer care, we can do a lot with our resource locally to serve our own community and provide equitable access.
Okay. Thank you very much. Have we gotten through everybody on that one? I think we have. We're going to move now to a new question. And let's see, we started with Nicole, so we'll start with Joseph this time. You get to kick us off. And that question has to do with two organizations in our community. Many in the public, confuse the health district and the health department, the public health department. How do you describe the roles of these two organizations and their differences? And how can we leverage the strengths of each organization?
I am not one to tell the health department how to do its job, but our mandates are very, very different. You know, we're both the health D, but I think of the health department as being more about human, safety, pandemic response, restaurant safety, general community health policy. The government wing that can be a big hammer if need be and drive policy otherwise. The health district, we used to take really the front seat in managing the hospital. We are heavily involved in policy advisory work now. There's not a huge amount of overlap that I see. Certainly the health department can't be making policy recommendations. They're a government wing. They're a little bit more the boring work of government. The health district, while we're still part of local government, we can get involved with, we can lobby, and we can have a changing role in response to the needs of the community.
Thank you. Okay, now we're going to move to Julie again. I will repeat the question happily. Many in the public confuse the health district with the public health department, which is Larimer County Department of Public Health and Environment. How do you describe the roles of the two organizations, and how can we leverage the strengths of each of those organizations?
I'm going to just follow up and adopt what Joe said. One is the administrative piece of a government agency, the health department, that is about safety. It's about making sure that our community is safe. I think the health district has a broader mission in some ways in terms of what it is able to do. And I think we have a role as the health district board to help educate the community first about the existence of it, because a lot of people don't even know that it exists. But that we have the ability through that, and people in the community have the ability to have an impact on policy, on education around health issues, around prevention, which is key, and around changing the dynamic in our community regarding the health of the people in our community in a way that the health department doesn't have a role in.
Thank you. Brian, would you like me to repeat the question? Okay.
Well, unfortunately, the health district and the health department are about 100 yards from each other, so that doesn't help with the confusion for the community. But the health department provides traditional public health services as an arm of Colorado's Department of Public Health and Environment. And so the health district is a health services district that's largely funded by residential property taxes. Not necessarily beholden to provide public health services. They can provide traditional healthcare services as well. A lot more flexibility being a quasi-governmental agency. So I think the health district, there are way more opportunities to, the health district exists to fill gaps in our community healthcare system. And I think there's a lot of opportunities there for the health district to step into a role and provide programming and services that are innovative and unique to the community that the health department would never be able to do.
Thank you. Joanna, would you like me to repeat the question? Okay.
I think the differences have been explained by everybody already. So I want to talk a little bit about what they do have in common. So something that both of these entities have in common is that we are responsible to be good stewards of your money. So both of these entities are run by our tax dollars. So one of the things that I feel that should be part of the leverage is our resources. So while the county is able to do some things and they cannot do others because they're a governmental agency, the district can do that. As Brian said, innovative responses are a space that we can really lead. And the other piece that I think the district can do is incubate those innovative ideas in partnership with other organizations. So I think, and I have to say that the reason why it's so important for us to think about these two organizations being responsible to our dollars is because it means that we also have a responsibility and to keeping them accountable.
Thank you. Next is Molly. Would you like me to repeat the question, Molly?
Sure, please.
Okay, good. Many in the public confuse the health district with the public health department, the Larimer County Department of Public Health and Environment. How would you describe the difference in the roles of the two organizations, and how can we leverage the strengths of each organization?
Yeah, so said just like that, it is confusing. The names are really similar. But actually the full name of the health district is the Health Services District. So the Health Services District is founded and, on providing health services. Public health, the health department, on the other hand, is focused on providing a clean and safe environment for us all. And if it's working well, you don't know it's working well. But the health department is the reason that you have safe water to drink, safe food to eat, clean air to breathe. Those health advantages are tied to if something goes wrong, then you need health services. So the two they're very linked. And so we need to work together. We do work together. We probably can work better together because the prevention of health, if something goes wrong, you need services for it. So we need to be in close communication around how to promote good health and then fill gaps when services are needed, or what are services that are over needed? How can we move upstream? How can we work with the health department to work on prevention for those?
Thank you. Coco, would you like me to repeat the question?
No, thanks.
Okay.
Again, such great answers here. It's hard going last because so much is said, but I do think the health district can provide those services that we find really unmet in that aren't being provided for. So to find those gaps, those unmet areas is key. And we also have a unique place to really listen to our constituents, to the members of our community, to find those gaps and really listen and bring those in, bring their voices in and say, what are you missing? Just like the questions here tonight, what do you want to see? What do you want to hear about? Not that that can't happen elsewhere, but I think this is a unique place where we can really bring voices in and come at it with more creative and out of the box thinking.
Thank you. I think you're back for number one, Julie. This has to do with the pandemic response.
Okay.
Is the health district prepared for a future pandemic, such as the coronavirus? And also, what might be the role for the district?
I think one of the things that we have seen in Larimer County and that I'm very proud of to be part of this county is the coordinated response that has occurred with the Health Services District. Thank you for that, Molly. And the Health Department. There's been a connection in ensuring that there's information that is shared, that people understand what is available in terms of protection, in terms of the vaccine implementation. I think it was a very thoughtful and complete partnership. And so I think based on that, we are better prepared for any future pandemic. I think one of the things that we can learn from the pandemic is working together to make sure that we have all the data that we need and all the ability that we can muster together with the health department, the health district, and other organizations and partner organizations in the community to make sure that we are getting information out quickly and consistently.
Thank you. Brian, would you like me to repeat the question? Is the health department prepared for a future pandemic such as the coronavirus? And discuss or explain the role that the health district might have in that situation.
Yeah, I think the health district is really prepared for a future pandemic. I think obviously there's been past pandemics. The health district has had response efforts in our community. There will be future efforts needed. I think the health district showed that they were prepared by responding and adapting quickly. I think what the health district's role can look like, and I think they leveraged this really well with COVID-19, is the health department is so inundated with the community response for COVID-19 or for the pandemic, and the health district can step in and fill other gaps that the health department's not able to do. And we saw that with people experiencing homelessness and the health district stepping into that role to provide isolation, quarantine, and vaccinations for people experiencing homelessness, where the health department just didn't have the capacity or the staff to do that. And so I think the health district can fill those gaps during a future pandemic that the health department is just not going to be able to take care of.
Okay, thank you. Joanna, would you like me to repeat the question? Okay. Is the health district prepared for a future pandemic like the coronavirus? And could you explain the role that the district might have in such a situation?
And the reason why I asked you to repeat the question is because previously you asked if the health department was ready and if
Oh,
the
I'm
health
sorry.
district. So I
Health
was
district.
confused. Yeah.
Thank you
yeah.
for catching that. Health district.
So the answer is yes and no. So, and before I go into that, I do want to make sure that if anybody from the staff from the health district, health services district is watching and just attuned to this broadcast, that we thank them for all the amazing and incredible work that they did. It was just beautiful to see how people adapted and were flexible and the incredible work that they did. And now to answer your question, yes, I think we are better prepared than we were before. And no, we're not prepared for another pandemic. I think right now we're all exhausted. We're all trying to get we don't even know if we are completely out of this pandemic. And the other piece is part of the conversations that we had as a board is everything was changing really, really fast. So answers that we thought we had protocols and preparations for things was changing daily. And that will happen again if we have another pandemic. So that's why the answer is yes and no. I do hope we're better prepared to reach out to marginalized communities, unlike this pandemic.
Thank you. Coco, would you like me to repeat the question? Oh, Molly, you're next. Molly, would you like me to repeat the question? Is the health district prepared for a future pandemic like the coronavirus? And explain what the role of the health district might be in that scenario.
Yeah. Yes and yes and no. I was thinking a lot of the things that Johanna said. It was a hard response, and for the staff working on the pandemic, still working on the pandemic, very exhausting. I hope folks do get some recovery and a break. I think we need, we've work to do around training our next generation of workforce in public health and at the health district. The other thing that I'm thinking about is that the pandemic really polarized us politically, and we have work to do around how we educate around science, how we use science to make decisions about policy, and that we, rather than responding in a very divided way to address a pandemic, we work to collectively respond and rather than fighting about how to respond. So yes and no.
Thank you. Coco, would you like me to repeat the question? Is the health district prepared for a future pandemic like the coronavirus? And what might the role of the health district be under that scenario?
So I think one of the things about pandemics is they're unknown. And when there's unknowns, there's fear. And when there's fear, there's polarization. And so I would like to say that this or that won't happen next time, but I think it is a reality when there's new information that's coming out and it's changing all the time. As humans, we don't know what to do with that when we keep hearing information that gets updated and changed. However, that being said, I did see the community come together in a way that I never have. I'm sure the health district was no exception. And that gives me hope. I think there's some simple things that we learned, like childcare kind of was a disaster right away, homelessness, finding food sources even for kids that weren't getting it at school. And we had some of these creative responses. So I think we are in a good place. I think we've learned a lot, but to say that we are prepared for the next, we don't know what's next. And when we don't know, there's fear. Hopefully we can keep the fear to a minimum.
Thank you. Joseph, you get to round out this one. Would you like me to repeat the question?
No, thank you.
Okay.
Preparedness, that's a tough question. In the early days of the pandemic, I served on AFM. We still meet every week, good Lord, on AFM's COVID Coalition, where in the early days we were meeting for several hours a day, trying to figure out what steps need to be taken, because there was a complete vacuum of advice, of policy guidance from a federal level during the early days of the pandemic. So it was left to every town, county, organization to basically figure its own way through this. And there was no clear rule set, kind of 6 feet, I guess, wear masks or don't, we're not sure. That was a slow response. One thing that makes me worry that we're not as well prepared is that Brian's no longer leading the community impact team. Brian, your work with the community impact team during the earliest days of the pandemic was amazing. Molly and I privately referred to you as Captain America, because when you would come on, we're like, he has got this. It depends.
Thank you. We've had a lot of fun with a lot of questions, but now you get a chance to talk just about whatever you want to talk about and to have closing statements. And we'll start with you, Julie. And it'll be 1 minute each or 60 seconds.
Okay. Thank you. And thank you to everyone who's here tonight. I know it's not the most exciting thing to do on a Thursday night, but thank you so much for your time. I am excited to have this opportunity. I would be proud to serve on the Health Services District Board as one of your board members. I would bring my skills as a mediator, as a judge, as regarding law and policy to the board. But as I listen to the other folks here tonight, I know that this district is in good hands, regardless of who is elected. So I would be proud to represent the Health Services District and be on the board, but I would also be extraordinarily proud to A, call any of these folks my colleagues, and B, to have any of them serve to represent us.
Brian?
Yeah, I'll echo Julie's response that this isn't a partisan election. Everybody here just wants to help improve the health of the community and has great perspectives to offer and value to add as a board member. The things that I think I can add, I feel like a unique perspective and experience of doing this community-based health improvement work for the health district and other community partners. I feel like I have a really good understanding of what those gaps are and what the needs of the community is. I also feel like it's really important during this transition with the new executive director to have somebody that understands the staff's needs and challenges and how best to support them coming out of a 2-year pandemic. And I think that I could offer that well-rounded experience as a board member.
Thank you. Johanna?
I want to thank everybody who's here and everybody who's watching and just getting connected, however you are getting connected to this broadcast tonight. And the reason is being an active in civic duty is so important and is so relevant to our community. So thank you. I echo what you have said. I think you have people who are dedicated and wanting to have a district that is healthier and that we can find solutions that people can access. And I think I already said what I will bring to the board and continue bringing to the board. I think it's really relevant the transition we're having with this new executive director. And I do think that having 3 new board members out of a 4 new board members out of a 5 board is not a good setup for a new director after having the same director for 27 years. I cannot stress enough how important it is to have some continuity within the board to help the new executive director.
Thank you, Molly.
Thank you all for listening and being here, participating in health. I think the good news is that there's no bad choices up here. I think that's been really clear and revealed in the last 60 minutes. Should I be elected, I think the one thing unique that I would like to mention that I bring that I haven't talked about yet is a vision of a pracademic, and that is someone who both has an academic experience and practical experience too. So while I spend a lot of my days on campus and learning and thinking and teaching about public health, I'm also committed to doing public health. And more broadly, I think there's a lot of opportunity for us to bridge between the university, between the scientists, and between people actually doing public health or implementing other science-based things. So if I'm on the board again, I'll look forward to serving as a pracademic on the board. And again, I want to thank everyone for being here and paying attention and knowing that health matters and trying to make a difference.
Thank you. Coco.
Yeah, I echo. There is not a bad choice. There is a lot of great choices. And I think that speaks to our community. Like, we care about our community, and that is special. I think I am uniquely qualified and bring a little bit more of a diverse background and a kind of more health and well-being approach. And I think it does matter that we cannot separate physical health and mental health and how we feel within a community, because they are integrated. And if we want to find solutions that matter, especially to our marginalized, we have to understand how all of these intersect and how we feel about our health, how we feel, what improves our health. And I think we have a great opportunity to look at policy, use our taxpayer money in a way that makes a difference. and I'm excited for what's to come.
Thank you. Joseph, the closing remarks.
The board is it's work, it's hard, it's service. It's I've had some fantastic conversations and learned a lot from other members of this board, but at the end of the day, it's public service and it's the right thing to do. My perspective as a family physician, obstetrician, I think that's a useful thing to have on the board. I think a variety of perspectives should be held on the board, and somewhat selfishly, I kind of enjoy it. It's tough, but I go home feeling like we accomplished things. I would be honored and happy to have my seat given to anyone up here. I'd be honored to work with each and every one of you. There's really no bad outcome here, but if you agree that a family medicine physician's perspective should be represented on this board, then please vote for me. And thank you all for being here.
And thanks you to all of these candidates. We really have enjoyed and appreciated your comments tonight. And best of luck. We'll take a 10-minute recess while we arrange for the next panel, which will be two people who are running for a one-year term. Thank you, everyone. We're going to close out our program with our final part of the forum, which is two folks who are running for one-year terms. And just a clarification for people who are perhaps watching this online or on television, there is a name on the ballot, Mark Longshore. He is not running. He has withdrawn his name. So know that that is not a viable candidate. And we have the two viable candidates right here. So we're going to start. We've got Aaron Hottenstein and Yanagi, and our candidates. And we're going to start with Aaron, and we're going to open with a chance for you to tell us, Aaron, what you're interested in telling us about why you want to be on the board and whatever else you might want to say. 90 seconds, please.
All right, thank you. Thank you so much, and thank you to the League of Women Voters for this opportunity, and thank you to all those who are taking in all the information we're giving. I appreciate you being here. My name is Erin Hottenstein, and I volunteered on the Compass Advisory Board for 2 years. And so we spent that whole time, trying to find new and interesting ways of, letting people know about the health district and all of its wonderful programs. So ever since then, the health district has had a special place in my heart. And because I've lived here for 22 years and I wanted to continue my service, I was really excited about running for the board. So one thing that's different that I bring to the board is that my early career was as a journalist. So I covered all kinds of government agencies at different levels, the ins and outs, and that really gave me a great appreciation for accountability and transparency. And I think that is important to have on the board. I also bring the perspective of a consumer. I have been on the individual health insurance market for many, many years. I know how hard it is to find the right policy every fall and what it's like to have to make choices around your high deductible policy. And lastly, I've been on a lot of community boards, including as a president. I've been attending health district meetings. I'm up to speed. I'm ready to go, and I'm fired up.
Thank you. Ann?
I'm Ann Yanagi, and I have been a resident in the Fort Collins area since 1989. I am originally from California. I'm a retired emergency department physician, and I'm a previous member of this health district board. I was on this board in the very early days, right soon after it split from Poudre Valley Hospital. I have served on many boards, at least two of them as president. I've started with the Victims Comp Board of the 8th Judicial District, our district, for 6 years. And then I became head of the Poudre Valley Foundation Board. I served on this board for 4 years. I was also the chair of the Fort Collins Symphony Board. I'm currently retired, and I was really quite happy about being given the opportunity to get to know the health district again and running for this board position because of my previous experience. I've learned ever since I came to this area that this is a community that likes to take care of their own, and the health district is a big part of that.
Okay, thank you. And we're going to start our questions now. I'll start again with you, Erin, and then we will rotate who starts first. This question is about, I would call it the low profile of the health district. And there are a couple of questions that deal with that. One is, I think they're related, and so I'd like you to comment sort of on the general theme. One is, what role might the community have in providing input into health district programs and policy? And related to that, how to increase voter participation in the health district elections. So it's really about raising that profile and communicating with the community. So you want to start with that, Erin?
All right, yeah. So there are some opportunities for the community to provide input. Of course, there's the triennial health survey and the focus groups that go along with that. That's one thing. And I know that the health district is out there doing outreach. So that's another way that the community can have that dialogue with the health district. That's so important. And I also agree with some previous speakers that a lot of people, maybe more people than we would like, don't know about the health district services, or they may have heard of the health district or seen the compass, but not realized, oh, like I could go to the health district and they could connect me with a therapist. They could get me assessed and connected with a therapist. So that kind of specific information. And then as for voters, yes, the more voters, the better, because I think that raises the profile of the district. We are trying to register as many voters as possible for this election, so I hope you do that.
Thank you. Ann, would you like to address that? Would you like me to repeat it?
No, I can
Okay,
go with
thank
that. The problem with the health district has always been nobody realizes what it is or what we do. And but if you mention the compass, they'll say, yes, I remember getting the compass. I get that all the time. And yet when you ask them, can you tell me what the health district does? A lot of times it's no. And it's quite frankly because a lot of the people I hang around with do not need community safety net. When you need that safety net, though, you find out what the health district does and that it coordinates with things like mental health, for prescription assistance, for low cost or no cost dental care. If I had friends like that, I'd say the health district has what you need. But it's true. A lot of people didn't realize, one, they're paying taxes for this, and two, that's what the health district runs on. Mm-hmm. And I like what the Compass is doing. I think something more along that would be very helpful.
Thank you. And this is sort of a related question. Explain whether the current budget priorities in the district and the health district are fulfilling the health needs of Northern Larimer County. And this time we'll start with Ann.
I definitely think they are.
Mm-hmm.
When I was first on this board, there was no dental clinic. And Carol Plock did her best to try and talk dentists into coming to South, or could we send them to their office? I was in the same position in the emergency department. I saw terrible teeth. I saw dental injuries, and I had no place to send them. I think that's one of the greatest things that the health district has done, is have dentists and low cost or no cost dental care. I think the mental health connection was very needed during this pandemic. There are a lot of people who were seeking mental health services and couldn't find it, which, by the way, I still think we're very underfunded for mental health services. I mean, if we weren't, we wouldn't have to supply that kind of connection. But it's definitely safety net for our community. It's not going anywhere.
Would you like me to repeat the question, Erin?
Yes, please.
Okay, good. Would you explain whether the current budget priorities in the district are fulfilling the health needs of Northern Larimer County?
So the two biggest buckets of the health district budget are mental health services and the dental clinic. And there are, so as Ann was explaining, there's a lot of work going on there. And I think that to the extent which the health district has that funding, it is meeting the needs as best it can. And I agree that that there's more opportunity there. There's certainly a lot of challenges with mental health needs during the pandemic. And I was, very happy to see the partnership with Summit Stone on the 24-hour hotline so folks can call and have somebody to talk to if they're not feeling good. And then as far as the rest of the budget, there are a variety of services that are covered there, including the cholesterol checks and the smoking cessation programs and the wellness programs and the suicide prevention programs. So I think they are definitely filling the gaps that they can fill with their funding.
Thank you. The next question will actually start with you again, Erin. Would you explain whether or not you support, or just tell us whether you support universal access to health care through improved Medicare for all? And would you support a resolution similar to the one recently passed by the Fort Collins City Council, I guess? I wasn't aware of that.
Yes. So the answer is yes and yes. But let me tell you a little bit about my journey first, because when this question came up for me 2 years ago when I was running for the health district, I had some qualms. I wanted to go check it out and learn more about it. It is a very complicated issue. And so I spent a lot of time watching documentaries about Taiwan and Britain and Germany and Canada. And I also, read up and talked to people. And what Medicare for All offers is covering everyone the healthcare that they need at about half the cost. And that, to me, sounds like a good solution. If there is a better solution, I would be for that also. But I think what my drive is to get more access for people for the health care that they need, and so that they are not going bankrupt with medical bills.
Okay, thank you. Ann, would you like me to repeat the question?
No, because I know the answer for me is yes.
Okay.
There is no reason in a country as wealthy as ours that we have a higher maternal mortality rates and higher child rates of death and disability. There's just no reason for that. But I could see it from my experience in the emergency department, because we would often see people who had no coverage, and even though we needed to do something, they were going to get lost in the cracks. In other countries, they have people who come to your house to make sure that you're okay. Do you understand the medicine? It was night and day when I went from private insurance to Medicare. And I'm the only person running for this board who is of that age right now. It is night and day. I think they take very good care, and they're preventive. They ask you about your blood pressure. They test your cholesterol. They do an EKG on you, for goodness sakes. I hadn't had one of those for years.
Thank you. Very good. And so, Ann, we'll start with you for the next question. And I'm going to combine a couple of questions that were asked of the group before, and that is about behavioral health, related to how you see the role of the health district in behavioral health, and any specificity you'd like to give to the fentanyl abuse issue.
Well, let me address fentanyl first. And it's not just fentanyl, it's opioid and substance abuse. But the opioid problem is huge. It was huge before the pandemic started, and it's done nothing but go up since we've been through this. And it ties right into the mental health, because people, you can give them Narcan and you can bring them out of the overdose, but you can't do much as far as trying to get them into some program where they're supported and they feel safe coming off of opioids. So mental health has a very strong connection with substance abuse, and I don't think we can address one without the other. And again, I reiterate, mental health is under-subsidized in this country for the amount of help people need.
Thank you. Erin?
Right. So these two issues are very important and critical. And yes, the opioid problem is, and the fentanyl problem. I saw the article in the Coloradoan, and it's scary, and it has definitely gotten worse during the pandemic. I'm very excited about the new behavioral health care center that's coming online. I hope in 2024. They're under construction, so yay. I think where the health district can come in and what they were working on before the pandemic was, and this was mentioned earlier, but I want to bring it up again, was changing the perceptions around mental health and the stigma with substance use, that is so important that the health district can take on that role of trying to change minds and help people understand that these are diseases that can be treated. So I do think that's where the health district can come in and make a real difference.
Thank you. And you'll be first up with this one. And that is, it's about healthcare access. Lack of access of services to traditionally marginalized populations is a concern. In what ways can the health district improve health equity and access to care?
So I do think that the research arm of the health district gives us a lot of information, and what I would like to see built on, even more than the outreach that they're already doing, is those partnerships with community organizations, with nonprofits, with other healthcare providers. And I also agreed with the previous speakers that all this happens in relationship. That if you're not having a conversation, I mean, this is not a one-way. This is not a one-way communication. It needs to be a two-way communication where we are. Johanna said it so well. We're co-creating the solutions. I think those are the best solutions, are the ones that we come up with together.
Okay, good. Thank you. And I guess you will get the. Let's see, you haven't had a chance to answer that question.
Right, would you repeat that for me, please?
It's access to care, and the lack of access to services to traditionally marginalized populations is a concern. In what ways can the health district improve health equity and access?
I find access problems are very culturally related. And if we do not have the type of people who can relate to those communities, then we need to work on that. And I say that coming from a Japanese American background, because my grandparents, and to some extent my aunt and uncle also, did not understand English very well. And what they needed was a Japanese-speaking physician. They also needed a Japanese-speaking care center and a nursing home, because otherwise they were completely lost. And what I see is, especially like in our Hispanic community, we have so many people who have the knowledge to do these things but can't explain it. And that's a gap in the way we look at accessibility. We have to go out and work on that.
Thank you. We're going to just do a couple more questions pretty quickly, and then we'll wrap it up with your closing remarks. The next question I have is one that has to do, we've talked around this issue a little bit, but talk about the difference between policy and program and why the health district might think it should do both.
Like policy on the national level?
Taking positions on policy at any state level, local level, whatever.
Well, what we do is very intimately related to what's happening at the state and the federal level. I don't think there's any way of getting around that. If there's something that's going to work for our community and we need to have it happen, we need to advocate for it. I don't think there's any way around that. You can't just sit back and say, we have to be completely neutral. I think if there's something like with mental health funding or something at the state level that would help, I think we need to go for it. And we need to pay attention to those two.
Okay, good. Erin, would you like to talk about policy versus program, or policy and program as activities, or maybe we should say activity arms of the district?
I really appreciate the policy work that the health district does. They really research things during the legislative season. They're meeting twice a month instead of once a month. They're getting updated on bills constantly, and I really appreciate that they take positions on bills that are important in our community and statewide. So, for example, I've seen them take up the issue of medication-assisted treatment and the things that need to change at the state level to make these things possible and to, put programs in place at the local level. So I think that is a great use of health district resources. And also the healthcare services programs that the district does are, of course, crucial to our community. So I think both of those pieces work together very nicely.
Okay, thank you. And this will be our last question, and we'll start with you, Erin. And that is, can you talk about the health district and the partnerships that it needs to have to do its job?
So the health district has a lot of partnerships, and I think those are important. So, for example, several years ago, the health district started training law enforcement and first responders and people in our community to give naloxone for folks who were overdosing on opioids. That is hard to say. And so, that was a great service that the health district did. And so I think that that it's important to have those kinds of partnerships, but not just there, with other healthcare providers, with nonprofits. And, there's different ways to partner with folks depending on the issue and the topic. But those partnerships, I think, are very important.
And it's related to partnerships.
We're already automatically in a partnership with UC Health because the health district owns that land and is responsible for monitoring that lease. That's our biggest partnership right there. But the other things that we need to do, especially for, like you said, for instance, in a pandemic, we're not on an island. All our clients and our services got disrupted by this pandemic, and the ability to shift and say, okay, we're going to give vaccines over there. We're going to help with housing over there. Maybe we have to work with Catholic services over there. They've got the room. This is the great thing about this area is the collaboration is possible because we can do these things on a local level. We know what fits here. And I think we never stop looking for those partnerships.
Thank you. We'll be wrapping up this part of the forum right now, but you get an opportunity to have a minute to talk about whatever closing remarks you would like to make. We'll start with Erin.
All right. So once again, I want to thank the League of Women Voters and thank you all for paying attention to us. I'm very excited about being a part of the Health District Board. And I wanted to share with you one last big reason that I'm running for the Health District. And this is hard for me to say and probably hard for you to hear, but during the pandemic, my dad, who lived in another state, died by suicide. And that was very hard for my family and me. And it just, really raised up for me the issue of mental health and suicide prevention that I know that the health district is working on. And it became even more clear to me when I found out that Colorado is 7th highest in the nation in suicide deaths, that this is an area where the health district can make a difference. And I want to use my voice to help those that are struggling. So I ask for your vote. Thank you.
And I'd like to thank the League of Women Voters, too. This has been a delightful evening for me. I come with a wealth of institutional knowledge about how healthcare has changed greatly in our community and what the health district has done in response to that. It has changed greatly since I was initially on this board many, many years ago, as has Poudre Valley Hospital to UC Health. And I welcome the opportunity to be able to get to give some of my knowledge into this job because I've had such a long experience in this community. So I thank you for listening tonight, and I hope for your vote.
A big thank you to both of you. I've really enjoyed hearing your comments tonight. And a thank you to the audience, but thank you for running. And best of luck.
Thank you.